Hello, dear colleagues. Можно этот экран? Жень, этот экран. My name is Mynzhylky Berdikhojayev, and my assistant neurosurgeon Abzal Khairatullah. And we have a patient number 2 with again MCA aneurysm. The first patient was also with MCA aneurysm, and now it's a patient number 2. It's a wide neck aneurysm on right MCA, and patient has headaches, and the aneurysm is nearly 6.5 millimeter, and it's a neck, and nearly 2.5 millimeter is a dome. And the plan is to place Leo baby stent, balloon in upper branch, and then place coils. We'll see about situation about the upper branch, if it's needed any additional stent or one stent will be okay. Let's see. I think like this is better, huh? This is better, but then it's interpositing. This is infundibulum. Okay, let's see the MPR. I think is this. Yes, it's look like an infundibulum. But no, it's aneurysm. This is choroidal artery, and this is a PCOM. And PCOM is aneurysm. Okay, let's see. Yes, this is aneurysm. Maybe something small is coming. Okay, and on the left side, можно пока это убрать на review. I need to see the right side. Just a second. Left side. Теперь можно опять на КТ. Yes, because of the some names on the screen. Oh, there is an aneurysm on the left side also. This is an aneurysm on the left side. It's just microaneurysm. We will follow, maybe we will treat with the stenting in the second session. It's possible to place stent like this. I think you don't. You see my mouse, and the aneurysm size is nearly. It's a microaneurysm, 2 millimeter. Oh, okay. Maybe half T stenting and one coil could be an option for MCA aneurysm on the left side, but it's a question of the second session. And today we will treat this aneurysm on the right side. Yes, it's look like it's infundibulum on the ICA, and there is MCA aneurysm. Okay. Опять можно ревью поставить. Just second. Пока на ревью. Сейчас я вот это выведу. And we need to find the working projection for this. Maybe it's a working projection, no? It's something like this. Yes, something like this. Yes, 575 and 3 millimeter. Okay, the plan is to place balloon in upper branch and then stand in lower branch. I think this Eclipse single lumen. We'll use gamma for coiling and Chikai black for navigation and headway 17 for no. We'll use just two instruments. Eclipse single lumen for upper branch and then headway 17 for Leo stand. Обзор. Just a second. Операция грейді. Даусын басып самайсың. Или даусын жай қойып қою керек. Okay, we are preparing headway 17, Chikai black and Eclipse single lumen. And stand will take Leo baby 2.5 25. Okay. Тоже Eclipse. Eclipse. İçindeki temirini alıp sal gerek. It's an Eclipse balloon and I think we will change for link mode. We'll change for link mode. And patient finally has two aneurysms. One is right MCA and second is left MCA bifurcation aneurysm. Yes. Баллонға мынаны қолданамыз. Абзал. Баллонға мынаны қолданамыз. Yes, so we have Y connector for headway 17 and this is a regular balloon, single lumen and preparation of Y connector 3-way stopcock, 5 cc syringe, 3 cc contrast, 2 cc saline, and now I will connect with balloon my Y connector. It's easy, it's like a hyperglide balloon. Hyperglide hyperform is this similar preparation. But historically I don't know which balloon came first, Eclipse single lumen or hyperglide hyperform. But historically silk stand. The first version came first, then pipeline came. I think the Eclipse balloon was first, but it could be mistake. That's why I need to clarify with the friends from Balt company. Yes, with friends from Balt company. The balloon will go for the upper branch, that's why the navigation will be not so complex. I just take nearly 4 centimeter wire outside. Now we will inflate the balloon. Yes, preparation of this kind of balloons is easy. You just inflate, and for the deflation need to pull the wire, and usually it's not problem. Huh? Okay. Мынаны 90 градусқа бұру керек. For headway 17, I asked Abzal to give 90-degree shape for tip of the headway 17. It's for navigation inside the aneurysm, and also to safely navigate through the aneurysm to the lower branch. And I hope we can easily push the stand from this part of the hub. Okay. This is Y connector for headway. Take it here. The angulation is 92. It's lateral. 92 left, it's 88 right. And then cranial 8 is a caudal 8. It's like in the mirror. Okay. Let's change for the link mode. And then we'll change the position of left and right, and for the 3D, let's see the 3D roadmap. It will be like this. Let's check it like this. It's a 3D roadmap, and it's not so good. I think it's better. It's like this. Maybe this position is better. Huh? Okay. It's for the AP, but we don't need this one, and we don't need 3D. It's a little bit annoying, and like this. Lateral and AP. It's not in all screens is available. It's a Flex Vision. Black 23 salary. We are in the MCA territory. Okay. Let's prepare Чикай Black. Петр, он ammunition. Хорошо. Ладно, славишь. Zoya, ben sen taş пересаш mı? Okey. Кыр. Кыр. Еще. Все. Я на наш пересал. Just a second. Yes, everything is ready. The stamp is on. It's here. Just put it here. Okay. Stop. It's just downstairs, and we need something like this. Okay, goes up. It's just a J curve, and this is microcatheter for stenting and coiling, and I hope we couldn't displace the stent. That's why if it will start to displace, then we will open the second microcatheter. Не наш пересаш. Спираль 3-8 деген болады. Микроплекс тұр. Болады, 6. И отделялкасын бере салыңдар. Көріңдер қайсы бар. Болады, андай да болады, андай да болады. Okay. Let's zoom it. It's moving, huh? It's moving all the time. It's a problem with the geometry. Қайттан қойшы? Geometry істемей жатыр. Okay. Just a second, there is a ritual from Absol. We need to put the table maximum. Осылай, да? And then we need to go up. Maximum, да? Okay, let's go down. Maximum, and we ordered the geometry model, but normal. We ordered the geometry model, but till now it's not available. And так, жена проект сханды болды. Ладно, максимально. Так, 24 крайняли и Yes, it's a big problem. In aneurysm cases maybe it's okay, but in AVM cases when you need to do roadmap and inject some liquid embolic, then it's a problem. Okay, stop. Smart mask. Now I will ask Absol to measure this point. this part of the aneurysm. For me, is on the lateral. As on review, it again like this on working. Шижет. Держи. Прям шейка до очевидно. Хорошо. Delete muscle. It's something like this. This is a neck. This is a dome. Nearly 3 mm. From this part till this part, nearly 6 mm. But this part is look like aneurysm. We will place the stent like this, and some part of the stent will prolapse to the aneurysm, and we will cover some part here. And then we will place balloon here and coil this part. Okay. It's like this. First of all, we will go with the headway 17, and we need to go to the lower branch. This usually should be no problem. Yes, it should be no problem. It's a small aneurysm, and navigation usually should be okay. Okay, like this, I think it's okay. Now we will place the stent first. Obsessively. I will ask Abzal to give me the stent. Question. This is little baby 2.5, 25. Cheers. Just a second. And on the left side, I think in the future it will need something like half distant assist coiling. Sure, it's yours. Yeah. As for little baby, I prefer, for long little baby, 25 mm. I prefer to have a headway 17 or headway dual and septa balloon. With the Eclipse, the long stance sometimes it's problematic. That's why I prefer to do it. Yes, I think the stent placement is better on AP than on the lateral. Now it should be okay, but on AP we can control the landing zone of the stent. It's quite distal. Now I think it's okay. Then we'll go to the aneurysmal part. And regular stenting without pushing the stent. I will put it something here. Again, patient on ticagrelor only. That's why. Yes. Okay, it's better to have a headway inside the artery, and to see where the stent is. We changed the anatomy, that's why it would be a little bit different than initial images. Stop. Yes, on AP it's clear where the stent is ending, it's not inside the aneurysm, that's why. Назад, чуть-чуть. Назад. Yes, on lateral also okay, but on AP is better. So, okay, now I will ask Abzal to give me smart mask and we'll orient mostly on AP. Yes. Should be okay. Yes, the branch is not so complex, that's why now the catheter is went to the aneurysm. We need to come a little bit earlier. Huh? Yes, now is better. As on lateral, we are not inside the branch, we are mostly inside the aneurysm. It's inside the aneurysm. Okay. The problem number 2 with this kind of wire and with this kind of balloon, during the time the wire is straightening, no, not that direction. So this direction, yes, now we are inside the branch. We need to go to the lower branch is better. Yapayım mı? Kızım. Okay. It's touching the dome. Okay. Heparin, okay, we need to manipulate with the balloon first, then if everything will be okay, we will give heparin, okay? Those look like easier. This is a problem of single lumen balloons, and this is a problem of not availability of Traxxas. Traxxas is not available in department now. Yes, we couldn't do our best. We need to adapt for the situation. Maybe double lumen balloon could be better. Then we can use Chikai Black and yes. We can go inside the stent, and now we can navigate the balloon. Ah, now it's better. Okay. It's quite soft wire. And now Now we're moving a little bit the stent. It's a problem number 2, huh? This wire is quite soft. Just a second. Yes, we pushed the stent in the direction of the aneurysm, but till now there is no problem, and I think we need to place headway 17 inside the aneurysm, place several coils, and then the eclipse could be pushable. Stop, назад. Okay. Now we see the aneurysm, huh? Okay. We will take wire. I think we moved everything. That's why. Yes, from this point we can just place a coil. Huh? After placing coil, we can manipulate with the headway 17. Okay, iteriyor. The coil is 3 by 6 microplex. With the stent, we change the size of the aneurysm. Stent is opened fully. It's nearly 3 mm, and vessel is nearly 2.5 mm. Okay. Coil is arriving. It's inside the aneurysm. Okay. I think we need to take out the load map. First of all, we will place coil, and then we can find a better position. Huh? I pushed a little bit my headway inside the aneurysm, and I think we are now inside, but one of the loops of the coil is outside. Yes, it's a problem of first loop of new coils. It's soft, huh? That's why it's a problem. Okay. No. Maybe. Something like this, huh? And aneurysm is white neck. We can put it here, and AP. Let's move with AP. Okay. Not bad and not good, huh? I think mostly the lateral plane. This plane is more informative, yes. I think now is better. Yes, now is better, I think. The coil placed as we wanted. It's inside that. Yes, we're also pushing the stent, eh? I think we pushed this stent maximum, and now the aneurysm is okay. It's changed with the stent, and we can assist with wire, no problem. Отделял бересиш? Yes, I think we changed the anatomy of the aneurysm. Басыр. Келесі спираль екі де алты ашты ғой, да? Екі де алты ашты.
Екі де алты ашты.
Микроплекс. Ага, микроплекс. Екі де төрт, екі де алты. Екі де төрт ашы бер. Okay, the next coil is 2.4 microplex. Yes, we did angiography. All the time I'm saying this package of the microplex is needs some improvement. It's need kaizen, huh? Unfortunately, my Terumo Nero, it's not looking for these videos, huh? Live cases. Okay, the most important is lateral view. That's why I will put this, and AP is not so important. You can see the subtracted and unsubtracted, and in these both views, this is more important than subtracted. Yes, luckily we have this mode of flex vision. That's why we can change during the procedure the images. Отделялка. И бір жағында 4 ашып бересің. This coil was 2x4, the first coil was 3x6, and next coil we're asking for helical super soft 1.5x4, and then I think we can finish. Yeah, sure. We changed the anatomy and we compress the stent, and it's usually helpful in healing process. Alright. Yes, on lateral we can see the coil is outside of the stent. On AP it's interpositing with the stent, that's why it's a little bit problematic. And on AP we see the stent is okay on distal part of the branch. Now we can place this coil. We need to a little bit release the microcatheter. Just a couple of millimeters. Пациент двигается, пациент двигается. Patient is moving. I hope everything is okay. Just. Yes, it's all the time the problem with anesthesia general. Anesthésie générale. Okay. Just last half millimeter. And now it's in poor condition, that's why we need to use it like this. It's better to use one time, but the distal part of the coil is not moving, no need to be sterile, and it's just retrieving after the placement. I think it's enough. It's a little bit filling, but it will thrombose, and the upper branch is opened. We can confirm with the I think we can do it like this, and then we can do it like this. As the branch is opened, there is some place for coils, but it became risky to place additional coils, and it will work, and I hope there is no problem. Yes, the best option is to place two balloons, and balloon assist coiling is better. But then yes, we will orient on lateral view. Yes, and stent is compressed, that's why there is no problem. Yes, the stent will do the rest of the job, and balloon couldn't push. Yes. I think we pushed the stent as much as possible. On lateral view everything is okay. On AP view everything is okay. Let's check without instruments inside. Yes, distal MCA is okay, the proximal part is okay, and stent maximum compressed at the level of the neck. There is some part of aneurysm is filling the up part with the upper branch, but I think it will modify it. If not, then in second session we can place one more stent in Y fashion or T stent, and then it should be okay. It's also placed for a couple of coils, but then there is the risk of coil migration. What is your opinion, Abzal? Or should we place coil?
Yes, there is a place for coils.
Okay, let's see. Maybe the flow diverter light effect of Leo Baby will work, and for the left MCA territory we will call this patient in 3 months. And in 3 months I hope it will change, and then we can decide in 3 months, and the stent will be opposed to the wall. Then manipulation inside the stent will be much more safer. Okay, now we worked for 18 minutes, and in 18 minutes everything looks good. The stent is patent. Kazakh thrombosis is okay, negative, and the medication is working now. the medication is working, which is ticagrelor and aspirin. Okay. It will be okay. Yes, now we can see it's an infundibulum of the PCOM, and there is a nice PCOM. It was a cushion aneurysm or not, it's not aneurysm. I put a little bit my guiding, and now we can do the control. Everything is okay. I will ask Abzal to do control XPCT, and then next patient is frontoparietal lobe AVM. We treated at the end of March together with my friend Alberto Gil from Spain, and today I hope we will see. It's a brain AVM on the right hemisphere. Okay, let's wait for the control CT and then we can decide. Okay, dear colleagues, the brain is clear, and now we can finish this case. See you in the next 30 minutes. Thank you for watching. See you in 30 minutes. Bye.